Welcome to Copilot Podcasts. Imagine walking into a hospital where AI helps doctors spot diseases before symptoms show, where robots assist in surgery with aerospace-level precision, and where wait times are cut by 30%. Today, we're diving into how AI workflows will reshape healthcare in 2026, and trust me, it's not what you think. We'll explore how AI is augmenting, not replacing, medical professionals. And joining us today is a healthcare technology expert who's been studying the intersection of AI and medicine. What's your take on where we are with AI in healthcare right now? Well, we're at a fascinating tipping point. According to recent research, 88% of hospital leaders are already planning or growing their AI investments for clinical support and operations.
And what's really interesting is that 89% of these leaders expect to see meaningful improvements in patient access and care coordination within the next 18 to 24 months.
Those are some impressive numbers. But what does this actually mean for patients and healthcare workers?
Think of it like this. Remember the invention of the stethoscope in 1816? It didn't replace doctors, it enhanced their ability to diagnose. AI is following that same path.
That's a fascinating comparison. You're saying AI is more like a superpowered stethoscope than a replacement for doctors?
Exactly. And we're already seeing real results. For instance, Duke University found that AI transcription reduced note-taking time by about 20% and after-hours work by 30%.
Wait, so doctors are spending less time on paperwork and more time with patients?
Yes, and it gets better. Mass General Brigham observed a 40% reduction in physician burnout after implementing AI scribes.
You know, this reminds me of something from Star Trek, their medical tricorder that could instantly diagnose patients. Are we getting close to that?
That's an interesting parallel. While we're not quite at Star Trek levels, AI diagnostic tools are achieving accuracy comparable to human experts in some areas.
But surely there must be concerns about relying too heavily on AI in healthcare.
Absolutely. The American College of Physicians recently emphasized that AI should enhance human intelligence, not replace it. They recommend that AI-enabled technology should be limited to a supportive role in clinical decision-making.
So it's more about augmentation than automation?
Precisely. And this is where we're learning from other industries, particularly aerospace.
Aerospace? How does that connect to healthcare?
Both industries require absolute precision and zero tolerance for errors. The aerospace industry has developed robust auditing and safety standards for AI that healthcare is now adopting.
That makes a lot of sense. What specific areas of healthcare are seeing the biggest AI impact?
Emergency departments are a great example. AI triage tools are helping verify care plans for high-risk patients and complex conditions.
And how effective are these triage tools?
Very effective. For instance, France's Shock Matrix AI has achieved accuracy comparable to trauma surgeons in emergency triage decisions.
That's impressive. What about other areas of hospital operations?
Well, hospitals are using AI for everything from preventing patient falls to improving surgical precision. For example, Emory University Hospital is using AI-enabled LiDAR technology to monitor patients and prevent falls up to 30 seconds before they happen.
30 seconds? That's enough time to actually prevent accidents from happening.
Exactly. And in surgery, AI platforms like SIDAR maps are creating detailed 3D maps of patient anatomy for more precise procedures.
But what about the human element? Surely we don't want robots taking over patient care entirely.
That's where it gets interesting. Some hospitals are using AI in very human-centric ways. There's an AI robot called Robin, designed as a friendly child, that provides emotional support in 30 U.S. hospitals.
A robot providing emotional support? How do patients respond to that?
Surprisingly well. It helps alleviate staff workload while maintaining a human touch. But there are challenges too.
What kind of challenges are we talking about?
A 2024 survey found that 75% of healthcare organizations report AI skills gaps in their staff.
That's a significant barrier. How are hospitals addressing this?
They're investing in training. The ACP recommends that AI training be provided at all levels of medical education.
But doctors seem optimistic despite these challenges?
Yes, 80% of doctors expect AI to enhance patient interactions. They see it as a tool to improve care, not replace human judgment.
Let's talk about the future. What can we expect in 2026?
By 2026, we'll see AI co-pilots in every clinical workflow, from diagnosis to treatment planning.
Co-pilots? Like in aviation?
Exactly. Just as pilots rely on automated systems but maintain ultimate control, Doctors will use AI to enhance their decision-making while staying in charge.
What about privacy and safety concerns?
That's where new international standards come in. ISO/IEC 42006 sets specific requirements for auditing AI systems in healthcare.
So there are safeguards in place?
Yes, and they're quite robust. The standard ensures organizations meet strict requirements for ethics, data quality, and transparency.
What excites you most about these developments?
The potential for AI to democratize healthcare access. When routine tasks are automated, healthcare providers can focus on complex cases and patient relationships.
Any final thoughts on where this is all heading?
I think we're entering a golden age of healthcare where AI amplifies human capabilities rather than replacing them.
Like that stethoscope comparison you made earlier, tools that make healthcare professionals better, not obsolete.
Exactly. And with aerospace-inspired precision and safety standards, we're building a healthcare system that's more efficient, accurate, and human-centered than ever before.
Well, that brings us to the end of today's episode of Copilot Podcasts. The future of healthcare is looking bright, and it's clear that AI will be a powerful ally, not a replacement for medical professionals. From emergency rooms to operating theatres, AI is helping healthcare workers do what they do best, care for patients. Thanks for listening.